Hello, happy Friday, everybody. Dr. Amy Ostick here with Health and Healing Direct Primary Care.
Dr. Brian Ostick.
We are 4 months into this pandemic. I stopped counting by weeks because it's just going to start to...
It's a little bit of a grind
It's
right
going to be a little bit, depressing.
Wait, before we go on,
Right.
We appreciate everybody's support for these videos that we've been putting out. We're
Yes.
trying to get you the information. I do want to say, when we look at our metrics for this, the video of you and my mom talking about college health
Yeah.
is by far the most popular, by far.
Mm-hmm.
Second most popular video that we've done is the one that you did last week, where it was just you talking by yourself
Yes.
about, do you need a COVID test?
Right.
So I don't show up in the metrics until
No.
the third place. And so my
Know your role. No.
plea to everybody who's watching right now, if you can watch the video, like the video, share it with anybody you can share it with, and comment in the comment section, that will get us the
That's
engagement
just your ego
push
talking
me
right now.
up into the top. I do
Maybe
not.
you're not...
I mean, I love
maybe
my-
you're not a favorite.
I love my mom, but she cannot be in the top
You need to
spot.
bring a little more to the table.
Okay,
So
all
we're going to let Dr. Brian Ostick drive this one here. We are not going to be talking about schools, as much as I know that is probably a hot topic right now. There is more to come on that information, and it's evolving, and I just want to take a breather. We're going to talk about bubbles.
So the NBA and the other major sports teams are doing their bubble seasons. And what does that mean? It basically means that they are going to test players and people that are working, everybody that puts on the video for the TV and all that sort of thing. Anybody within their bubble is going to be tested for COVID, both before they arrive and while they're there for an extended period of time, to make sure that they're not positive for the virus. And this is how they're going to try to protect their players and their employees.
And this has been endorsed and supported by public health officials, saying, if you want to do a league, here's how you can do it safely, like a sports league. You've got to bubble it.
So we have a lot of questions from friends and family that say, it's summertime, I'm really feeling this quarantine thing, and I want to get together with a small group of my family, either by the lake or by the beach or in their own homes. And is it safe? And our thoughts have been, and we've said this before, is that anytime you're going out and mingling with other people, there's risk, and you cannot make that risk absolute zero, right? So you have to understand that you're going to be taking a risk if you are going out and meeting with family or with friends. But one of our ideas was, maybe you could create your own bubble within your own small group of people, family, really, if you're going on vacation for a week or so this summer. So how would that work?
Yeah. So you've got to get the testing, and you've got to get the right testing. So creating a bubble means that you're basically taking people who all have tested negative for the coronavirus and putting them together, and theoretically then not exposing yourself from that point onward if you're there for a week or something. So you're not going out to the bars, you're not going out to large congregational areas, you're coming from different spots, so you want to rule out coronavirus before you come into your bubble. Now, listen, again, what Dr. Brian Ostick is saying, the risk is not zero, because there's really 2 types of tests that you can use to look for acute spot on or acute infection. So that's the PCR molecular test, and then there is the rapid antigen test. The molecular test, the PCR molecular test, is the oral or the nasopharyngeal swab, and that test turnaround time is about anywhere from 3 to 7 days. We had a real kind of lag in our turnaround time about 2 weeks ago prior to July 4th, because everybody was trying to go on into their bubble vacation. So the turnaround time was about 7 days. It's a lot better now, but typically about 3 to 5 days of that turnaround time. So think about that before you enter your bubble, about doing your PCR test.
So that's a swab.
So that's a swab.
What's the other test?
The rapid antigen test, and that's basically looking for, it's a different type of test. It's rapid. It takes 15 minutes. Not as sensitive as the PCR test, but it's pretty good. And that's either in the nares or in the throat.
Also a swab.
Also a swab, but it takes 15 minutes.
What can't you do to what test is not going to be a valuable test if you're going into a bubble?
The antibody test would be invaluable, right? So that would be that would be basically would not be worthwhile, because basically what that says is maybe you had the virus, months ago, and if it's negative, it just means does not rule out you're having the virus right now, because you may not have mounted that antibody response yet.
And even if it's positive, we're not really sure yet if having the antibodies protects you from getting it a second time or not. So, really you need to know if you have an acute infection at this time, and that means stick a swab in your nose or in your mouth, and if that's negative, then you're okay to go to your family bubble.
To go to the bubble. Now, the caveat also is that whenever you get that test, from that moment until you go into your bubble, your family bubble, you can still contract that virus. So our recommendation would be to self-isolate or self-quarantine until that time period to really reduce that risk.
Right.
If you get a swab and then you go out to the bar or you go to a house party and then you go into your bubble, then it's basically meaningless at that point, because now you've exposed yourself to a higher risk scenario. So that's the best we can do at this point to keep ourselves safe this summer if we want to go on family vacations. And I think that the risk-benefit ratio is in favor of doing this, because we do need each other. We do need these community and family gatherings, even if they're small and low risk, and especially if they're low risk, because it is good for our mental health.
Mm-hmm. Lastly, where can you get tested? So you have the LA Department of Public Health that's doing some testing. I've heard people are having trouble getting an appointment for those. The testing has been limited, to say the least. And so if you can get in and get tested there, great. Dr. Ostick is testing her members only, and has the ability to do both the rapid test or the send out PCR test, as well as a send out antibody test. But again, only for members.
Yeah, if you're not a member of HHDPC, check your local CVS pharmacies. They're also doing testing. You can check your local urgent cares. They're doing testing. And that would be, that's how you would do it.
All right, let's get this video up and post it, and make sure that you share, and you comment. I need those engagements. We need to beat my mom in that video. Hashtag overtake Mary Agnes.
No. Next week we'll get some more input maybe on schools, but
I think we'll have more info next week for the schools.
We're going to let the governor take the lead on this for now.
Fingers crossed. All right, www.healthandhealingdpc.com.
Dr. Amy Ostick here. We're here for you. Take care of yourself. Take care of one another.
Wash your hands.